We should always think first of food, no? So there's different ways to ensure that the food that we have has enough nutrients in it. One is some foods are much richer in nutrients than others. For example, animal source foods, meat and in small quantities. Dairy products are much higher density nutrients than, for example, grains and legumes, right? So that's one way. So if you're preparing a small food for a small child, you can incorporate a small amount of animal source foods in there, and you increase the nutritional value. That's often economic barriers exist to that. So an alternative is fortified foods. Most of us as parents have, in Canada, purchase baby foods for our children. Those baby foods are fortified, which means that they have been commercially produced and additional nutrients have been added to them so that with the quantity of foods that small child will consume, they'll get what they need. So that's a second way. So there's what you call dietary diversity and food preparation, food fortification, which is the second one. And then a third one, when neither of those two options are either sufficient or feasible, then you can also consider nutritional supplements, which can be in the form of a powder that you add to the food. It's almost like fortification, but you do it in your own home, in the bowl for the child, or syrups and other types of nutrient supplements. Micronutrient Initiative works on a number of interventions. Our focus is, like as you mentioned, micronutrients, but we do try to focus our work within the context of what is going on in a country. So for example, over the 25-year history of Micronutrient Initiative, they've done a lot of work supporting the salt industry to lobby for and provide technical support for the iodization of salt. And so in that sense, it's a very simple intervention, right? You don't really need to work with anybody other than the salt industry if the salt is iodized and that's what people purchase. If the laws are in place and quality control, there's nothing else needed. So that's one model, shall we say. Another one is a very complicated model where you're working on encouraging populations to diversify the types of foods that they give to small children, to change the way they prepare those foods for small children, or add micronutrients, like I mentioned, those powders that you can add to the child. On that type of intervention, we have to work very closely with those who have contact with the population. So we may, in all countries wherever we always work with the government, and we work with other partners who are implementing programs. So in the case of a complicated intervention where you're encouraging a population to change behavior so that the foods that the child is consuming are more nutritious, our work is very much on many fronts. We may again be lobbying with the government to get them to invest in that type of program if it doesn't exist yet, to get the policies and programs in place. If those policies and programs are in place, we may be working with those partners who are implementing them to ensure that the methods that they use to get those products into the points of distribution, like the supply chain, we may work with that side of it because there are always issues with supply chains, right? We may be working with public sector programs, for example, the healthy child visits in clinics, that happen in most countries around the world, to ensure that when that mother meets the healthcare provider, we're effective in the messages that we have so that those mothers will incorporate those foods into the child's diet and to use those supplements that are being distributed. So we always work in partnership with the government and with implementing organizations, but we focus very much on ensuring that you've got the right product and you've got the product, that the supply chain and procurement is functioning, and then you have an effective strategy for delivering and ensuring utilization. What I think one thing that we are doing more and more of now is the recognition that you can deal with policies and you can deal with supply chains, but if you don't also focus on that aspect of utilization and what you call behavior change, convincing the population and even the healthcare providers of the importance of these interventions, you'll never be effective. So that's a big part of where we're also beginning to work. We've recently started doing some more work in maternal and neonatal programming. we have for many years worked with programs for children. So that example that I just gave of where you're trying to get the mother to incorporate a supplement into the diet of the child, that would be a bit of an example of how we work with children. For women and newborns, again, it's a similar model. Those programs in many countries exist. Antenatal care exists. But there are often issues related to access of care. There's issues related to the utilization of that care. And there's issues related to the quality of it. So if we just, for example, we would like women to be taking iron folic acid supplements during pregnancy to prevent deficiency both in herself and in her newborn. But if you don't have a delivery platform, and if you don't have a good quality care in that moment so that the provider convinces the woman of the importance of taking these tablets, and if women aren't using the services, we'll never be effective. We can't just focus on, here we have the perfect magic bullet, we just have the perfect pill here. We'll never go anywhere with that. So the work we're doing now in Africa, for example, with support from the Canadian International Development Agency, we're working with countries where they have those programs, antenatal care is there, but we're working on strengthening both the demand for that care, the quality of that care, and then ensuring that nutrition is adequately paid attention. Even where programs have addressed the issues of quality of care, they typically have not had much focus on the nutrition component. So we're working with partners, in this case, the partners who are working on maternal and neonatal health as opposed to child health, focusing on those partners who are working in maternal and neonatal health, focusing with that department of the Ministry of Health to support them in strengthening them and using that as a platform for delivery of essential nutrition interventions and specifically micronutrient interventions. We have a lot of momentum right now. When I started in nutrition a very long time ago, we were the poor kid on the block. No, and a part of the problem with nutrition is that it's important for all aspects of health. It's important for national development. It's important for education, ultimately. But we don't sit anywhere. You know, we're not the ministry of nutrition. There is no such a thing. So we need to be everywhere, but we don't actually sit anywhere. So a true priority is figuring out how can we work with all of the sectors within a country that we need to be working with effectively and maintain and sustain that commitment and that involvement and have it long lasting. We lobby with governments that they should evaluate their programs. We then work with them with the results of those evaluations to say, look what you can do for your population by making these investments. And in some of the countries I worked in, with some of the programs that we've worked with, both at IMI and previously, we see a change. We see when those results are presented and when people realize what you can do with providing that commitment, that investment, and keeping it going and not just having it as a short-term, you know, from today until tomorrow type of investment, those commitments get written in. They get written into the books, and it's there. And we've seen that happen in many countries. In, you know, my experience of personally in country is much more in Latin America, and we've seen huge investments now in interventions for nutrition because they've seen what can happen with that, and they can see the results that it can provide for the population.